This podcast is proudly brought to you by our partnership with Bayer's for the Ask Maya chatbot service. Ask Maya is a friendly chatbot that provides information and options for family planning. So do check out the new tab in our Doctor's app homepage for free counseling advice.
Hi everyone, welcome back to another episode of Doctor Us podcast. In today's episode, we'll be talking about ringing in the ears, what it actually is, the reason behind why some people experience it, and the possible treatments for it. But first, have you ever experienced a brief moment of ringing in the ears? That phenomenon is known as tinnitus. Depending on its severity, it can be a highly uncomfortable and annoying problem for some people. Tinnitus is the perception of a ringing, buzzing, hissing, or roaring sound in one or both ears when in the absence of an external source. It may be continuous or intermittent, can be pulsing or steady, and can range in severity from a soft buzz to a loud ring. Although tinnitus can be annoying, it is not usually a sign of a serious problem. Rarely, tinnitus can be assigned to a more sinister underlying cause. Tinnitus can be caused by damage to the tiny hairs on auditory cells within the inner ear, or it can be a result of problems not related to the hearing system. First, let's talk about hearing system-related tinnitus. As mentioned, damage to the auditory cells in the inner ear may lead to tinnitus. Such damage can be triggered by the following factors. First, normal aging that leads to age-related hearing loss. Second, after an exposure to a very loud noise, which results in noise-induced hearing loss. Third, side effects of certain medications. For example, rapid infusion of furosemide, a diuretic, quinine, a medication for treating arrhythmia, previously used for treating malaria, aminoglycoside antibiotics such as gentamicin and streptomycin, and platinum-based chemotherapy, cisplatin, carboplatin, and oxaliplatin. Nonetheless, the number of drugs that genuinely cause tinnitus is extremely small, and these are outlined below. For most medications mentioned here, there is no scientific evidence to either support or refute claims that they cause tinnitus. Fourth, stiffening of the bones in the middle ear, also known as otosclerosis. Fifth, tumors within the auditory system. And lastly, diseases such as Meniere's disease, blood vessels or neurologic disorders, and genetic or inherited inner ear disorders. Other reasons, such as disorders of the jaw joint called the temporomandibular joint, severe anxiety, and neck injuries can cause tinnitus as well. These are known as the non-hearing system related to tinnitus. If you think you may have tinnitus, consult a doctor for further diagnosis and treatment. Tinnitus does not have a cure yet, but treatments that help many people cope better with the conditions are available. Most doctors will focus on the following treatment strategies. First, treating the underlying problems. If the doctor managed to diagnose what exactly is causing you the tinnitus, then fixing the underlying causes could relieve the tinnitus. If the problem is related to hearing loss, use of hearing aids such as cochlear implants can help people with age-related hearing loss. If it's because of medications, doctors may consider stopping the use of medication. However, you should not stop your own medication without consulting a healthcare professional first. As for depression, it is fairly common in people with tinnitus. Safe and effective treatments for depression are available, and antidepressants medication may improve the symptoms of tinnitus in some people. Antidepressants can also improve a person's ability to cope with the problem. Second, behavioral therapies. A number of behavioral therapies can help a person to live with long-term tinnitus. These therapies, however, may require a doctor's referral to auditory experts. For example, tinnitus retraining therapy. It involves retraining the hearing system to accept the sounds associated with tinnitus as normal, natural sounds. The goal is for the person to become unaware of their tinnitus unless they consciously choose to focus on it. Another example would be masking. Not our daily mask wearing to prevent COVID-19. Masking, in the context of tinnitus, is a device that resembles hearing aids and produces low-level sounds, which help to reduce or eliminate the tinnitus noise in some patients. A few other examples of behavioral therapies would be biofeedback and stress reduction and cognitive behavioral therapy. Other therapies of treatment for tinnitus would be electrical stimulation, acupuncture, and vitamins and minerals. Niacin, vitamin B3, can potentially improve blood flow in the ear and may help with tinnitus. However, no controlled studies have shown a significant benefit of niacin or other vitamins for tinnitus therapy. Zinc and copper are antioxidants that may improve the health of auditory cells. Some people report improved benefits with the use of these vitamins and minerals. However, no scientific evidence so far has demonstrated their values. That's it for this week's episode. If you have any questions related to tinnitus, you can consult our professional doctors and healthcare professionals on Dr. Us. Dr. Us is a mobile application that allows you to talk to a doctor or any healthcare professionals via text chat at any time and from anywhere. For better communication, you can even send our online doctor images or voice messages related to your medical inquiry. Download Dr. Us app on Apple App Store, Google Play Store, and Huawei App Gallery, or even use our web chat at web.drus.com. Dr. Us is not for medical emergencies. In the event of severe medical conditions, please call 999. Take care, and we'll talk to you next time. Disclaimer: as a service to our users and general public, Dr. Us provides health education contents. Please note the date of last publication on all podcast episodes. No content in this podcast, regardless of date, should ever be used as a substitute for direct medical advice from your doctor or other qualified clinician.